President Trump refusing to give up on getting a health care bill through Congress. The president delivering a sharp message to Senate Republicans this afternoon.
So far, Senate Republicans have not done their job in ending the Obamacare nightmare. Any senator who votes against starting debate is telling America that you are fine with the Obamacare nightmare, which is what it is. To every member of the Senate, I say this: the American people have waited long enough. There's been enough talk and no action. Now is the time for action. We are here to solve problems for the people.
Amid the intense pressure from the White House, Senate Majority Leader Mitch McConnell announced a short time ago that the Senate will consider health care legislation tomorrow. Now, we'll bring it around, Congressman Chaffetz. I'm not even sure at this point which legislation they're going to vote on. Do you?
It's not just you, Eric.
Well, look, the United States Senate is supposed to be the most deliberative body on the face of the planet. The first question that comes to the Senate is, should they debate it? It is a yes or no question. It's not about a specific bill, but once that passes, and there is not a single Republican that should vote against that. I don't care where you are in health care. The American people deserve a vote and a yes vote so that they can actually have that debate. What amendments get brought up? Mitch McConnell has not shown his hand on that. I don't think he wants to give anybody an excuse for getting off for voting no. I think that's why he's holding that close to his vest. I think it's a game that he's playing. But the first vote is just whether or not to proceed and have the debate. And President Trump is absolutely right.
I'll bring it around, but I just want to be clear, Mitch McConnell does not want to proceed to a vote, even to debate it, if he doesn't have a final yes on something, right?
I think they have to put up a vote. Even if it fails, what the American people don't understand in the heartland is when they don't even vote on things. So the only vote, the only question tomorrow is, should we debate this? And should we have this discussion? It's as simple as that.
All right, Ebony?
Okay. So we know that the president doesn't like red lines when it comes to national security. But I think, Eric, and what we heard from President Trump this afternoon, a very clear, bright line in the sand around how he's going to view and paint aggressively any Republican senator that doesn't vote for this tiny little incremental thing that the congressman is describing. Because it's really, to me, as tiny as you can be in terms of effectiveness. Is it going to be open for discussion? I think it's a little bit of a vanity vote. I think it's a bit political. But when it comes to the president making a very clear line around any vote in opposition to this is a vote basically for Obamacare, that's what he's saying.
Okay. Kat, I'm going to take it one step further. Let's talk a little bit about the political risk of getting closer, going to a vote, which means you debate, but then if you vote on something, does a loss put up too many negatives, too many losses, put a big L in your policy scoreboard, so to speak?
Yeah.
You want that right now?
Well, I think that they've been taking L after L after L on this one. It's hard to even keep track of all the L's. It's been pretty bad. And yeah, and to your point, I agree they should debate it, but when we have people that have problems with it, and they have problems for two opposite reasons, either that, you know, there's the freedom liberty people, that this is too much, and then the moderates who say this isn't enough. How do you ever really reconcile that?
You don't.
That's what I don't know.
You vote. You have the debate and you vote.
So that you can then say, what, Congressman? See, we got it to debate.
No,
what's the big prize there?
Look, the senators meet about 3 times a week and they have lunch and they have a discussion. That isn't good enough. It's a whole different game.
Yeah,
you have to put your name and put it up on the board and say, I'm the one that kept Obamacare in place.
Here's the other option. They can go ahead, debate, and then they can vote on the clean repeal, which we have Paul. And Paul Ryan, if I'm not mistaken, Paul Ryan was in favor of a clean repeal bill.
Never going to happen, Eric Bolling. They are not going to vote on clean repeal. You talked about those moderates and other Republicans who's like, look, if they couldn't get their act together in 7 years, do we think if we give them one more after we've repealed Obamacare? Right, exactly, they'll be able to do it.
They voted on it in 2015, 18 months ago.
When it meant nothing. When it meant nothing, Eric.
Right, but the House and the Senate passed it. Barack Obama vetoed it. And we have the same House and Senate right now. Why wouldn't they vote for it?
Because, Eric, it's been the same thing, which is now it's the real deal. Now they'll actually have to live with the consequences. And at Rasmussen Reports, we're finding that actually the popularity of Obamacare is going up. That 49% of likely voters actually have a favorable view of Obamacare. I mean, the high water mark for repeal was in November was only 40%. And there's like, 30, here's like the big number you should think about. 32 states that accepted Medicaid expansion. And a number of them were Republican states, like including Nevada, for example. Those senators in those red states that accepted Medicaid expansion are very nervous that repeal and reform will hurt their constituents.
Give you another one. 38% of the country will have counties have one
Absolutely.
or no insurers in 2018, you think you're still going to get a 42% approval rating?
The 49% that we have right now with likely voters. No, I agree with you. But if Republicans then pass something that sends premiums even higher, that have even worse outcomes than we're seeing right now, then they own
what
that
Amy
mess.
is describing, by the way, is no compliment to Obamacare. It's simply showing how afraid people are of going from bad to worse, Congressman.
Look, when you're playing with live ammunition, as they're doing now,
Right.
It's time for them to put their name next to that box and vote. And the simple question is, do you want to continue with Obamacare or do you want to make it somewhat better? Make them vote.
I would like to see them do this in a more incremental way where they can
That's
get a
the
broader
repeal.
consensus.
That's what I'm saying.
Repeal is 180, then you
Straight
start over, Eric.
repeal,
We know
of
that.
course,
And if
yes.
they couldn't get it together for 7 years, do you expect they will in just one more?
No, it's no rush on replace comes down the road. You repeal now.
I don't think that's going to play well.
Yeah.
That down the road.
I agree that everyone should repeal it, but I feel like when we have all these different objections on the opposite ends of the spectrum, what do you do about
And
that?
that becomes very scary when you don't know what it's being replaced with.
Yeah.
All right.